I was actually born without blindness, but I was extremely preemie. I was a 9-inch long baby. Yeah, I was really, really tiny. And what happened was the doctors had to give me oxygen because I was limited with it. What happened was they gave me too much and my blood vessels were growing too quickly. And they gave me medicine to help stop it, but then cataracts developed and my retina is detached due to pressure, and now I have scar tissue there.
So blindness can be caused by anything that affects the structures from the cornea to the lens in the eye to the retina. So injury, diseases of those structures. So once light passes through the eye and hits the back, anything that damages the retina or damages the neural connection can inhibit vision from being processed in the back of we call it the visual cortex of the eye. So when babies are born premature, those blood vessels haven't had time to grow as far into the periphery of the retina. So when that retina is without blood flow, it starts to atrophy or die, and when it does that, it creates scar tissue and it starts to peel off, and those create retinal detachments.
I think you guys should know Hope is very capable of everything. She's more capable of things that I'm not even thinking I could do. She's very bright and she doesn't actually need our help. People want to send her to the blind school, which would just baby her, so she picked having a regular school so she can show people that she's okay and with everything she does.
In my free time, I like to play my clarinet, and I like to read books and do a lot of writing. One of my passions is music.
For the concert DVDs, I forgot to ask you, but I want to get them ordered. Belinda's so excited she's already paid for hers. So I gotta make sure that I get them ordered. She's like, I just handed around, if you want me to order you a DVD, 1, 2, 3, 4.
My friends, they just help me out with classwork most of the time. They help me get to classes if I am lost or need some assistance, because sometimes I have to go across from certain things and I tend to veer.
I am actually Hope's paraprofessional. It is my responsibility to assist Hope in anything that she needs during the day. Most of what I do is to make sure that her assignments are in a format that she can understand. Most people that have visual impairments, it takes them twice as long to do assignments as their peers. So while a lot of her peers are going home and have 30 to 40 minutes of homework, she's got hours of homework to do to stay up in all of her classes. Her textbooks, for example, her history textbook is 13 volumes. That means it's 13 times the size of what a normal textbook is for her peers. And she'll read along in those textbooks just like her peers do. So she faces a lot of hardships, but she does it with a smile, and she always overcomes all of those things that are thrown at her. She's quite an amazing girl.
A lot of the kids think that I don't do a lot of the assignments that they have to do, but we have to, a lot of the times we end up altering them to where I can do them. And so I actually end up getting it harder a lot of the time, because first we have to change the assignment, then I have to think of those changes and then do the assignment in the way that it's wanted to be done.
PDFs don't work really well with a lot of the technology that Hope has, along with anything that's on Google Chrome or Google Docs. Those really have a hard time for Hope to be able to see, so I take those documents and I format them and I'll send them to her via email. Through the email, she can either pull it up on her Braille note, where she actually has the document in Braille, or she can pull it up on her laptop and she can use a software called JAWS that's actually going to read to her what the assignment is.
To change ribbons, use left or right arrows. To navigate the current ribbon, use Tab or Shift Tab. T-Tab, lower ribbon, Pre-Tab. Transition to the slide toolbar. Group, Tab. Effect options button drop down unavailable. Tab, Edit, 1 of 6. To Tab, Duration, Edit, Z-Tab.
A lot of people don't understand all the types of technology that Hope has. She uses a cell phone just like all of her peers do. She has an iPhone, and while she may not see all the apps that she's accessing, they have a program called VoiceOver from the iPhone that she actually can do certain flicks and move her hand in a way that it maneuvers her through the iPhone just like her sighted peers. So she can send text messages, she can call her friends, she gets emails on her phone, she gets emails on her Braille note, so her friends can send her an email or I can send her an email, and it's going to come up to where she can actually read it in Braille.
The Braille note does help me out quite a bit, actually. It puts things in Braille so I can read it. And actually, how it does it is it actually uses crystals. And every time there's a dot, one of the crystals raises.
Pictures I go through and I'll actually describe to them. And then if there's certain graphics on test, then I can run those through a program called Picture in a Flash. So it actually raises the tactile picture so that Hope can see what the other students are seeing, and she can actually answer the same questions that her peers are answering on their test.
I am actually in the process of getting something called a pen friend. And what it is it's like a pen but thicker, and it has batteries in it. And what it does is there is labels that you can actually record the item on the label, and you can put the label on the item and then play back your voice recordings, and it will read back to you the item.
The career of optometry is one of those great professions in the health field. We provide vision exams and prescribe glasses and contacts for people, check eyes for ocular health, and treat infections, injuries, and in some cases refer patients on for surgeries or advanced treatments. If there is permanent vision loss, they do cryotherapy, which is a type of cryo's cold freeze. So things like that, or if it's more around the retinal side. So if we see someone that's losing vision on the retinal side, they can go in there and reattach the retina by using cryotherapy, which is freezing. You can do it by laser. So if people have problems with their retina coming loose, we can use lasers to photocoagulate the blood vessels. Like in diabetic retinopathy, you can cause lasers to do scar tissue, which sort of is, your retina's like wet tissue paper. And so when you laser it, sometimes you're trying to make it burn or create basically a sticking of the retina to the back. And so there's different types of laser. They also go in and can surgically put buckles around the eye to kind of keep it attached. And then there's different drug treatments. A lot of devices are meant for people that are in that legally blind stage, not complete blind. But services for those that are complete blind include Braille, phones, things that you can feed in and it'll print it out in Braille for them, Braille watches, devices that you can add to your electronic devices. And then also we're kind of in a day and age where the voice command is almost accessible everywhere. You know, voice command can be kind of linked into everything. So technology has kind of moved its way to help, you know, those with the disability of blindness. Cell research, they take embryonic cells and they have been able to regenerate retinas in mice, where you can put these retinal cells in blind mice. I always think of that 3 blind mice. But there's a lot of controversy about where do you get your stem cells from? You know, what's the ethics on growing stem cells? The more the movement is going towards the stem cell research.
One of the things that I would like to see is a little bit more friendliness in some places. Like some restaurants don't have braille menus, and a lot of the times people don't want to read a long menu. And so I would like to get braille menus put in a lot of restaurants, and hopefully cars that can drive by themselves, because that would open up a mountain of independence for me, because then I wouldn't have to rely on other people.
I just want to see Hope be successful and to be independent. I want to see her to be able to go to college and to be able to go to all of her classes independently and to get her degree and to go on and do all the things that she wants to accomplish. And I think that anything that we can do while she's here at Sheridan High School to help that, I think the better.